As with any medical treatment, individual results may vary, and this experience is unique and specific to this patient only.
It's important for me to maintain an active lifestyle for a couple reasons. One, for my own health and sanity, and then two, I work as a physical therapist assistant, and so I'm always stressing to others about how important it is to be physically active. I have had bunions as long as I can remember. Growing up, it's something that's run through the family, I think. The bunions were getting to be more and more painful the older I got and the more active I became, to the point where I would need to stop and rest. They were achy and a burning feeling. It was red to the eye. And then actually with my running shoes, I was starting to blow out the sides of them where the bunion was.
I know Laura both personally and professionally. She is one of our physical therapy assistants at our local hospital. Laura had a bunion deformity at her great toe joint that I would classify as moderate to severe. It was making standing and walking difficult, exercise was difficult, and shoe wear was difficult. I had previously treated Laura with conservative means of treatment and therapy. Unfortunately, Laura did not improve over time as she had hoped. I also offered Laura two-dimensional traditional surgical procedures in the past, which she was not happy about and she did not want to proceed with, due to the fact that she was concerned that there would be a lengthy period of time in which she would not be able to return to work and do her things that she wants to do with her family. When Laura found out that the Lapiplasty procedure was an option, she jumped at the opportunity. It limited the amount of time that she had to take off work, it got her back in the office quickly, and it allowed her to continue to be a mom.
When Dr. McAleer talked to me about the Lapiplasty procedure, he kind of explained how it would work, and that really made a lot of sense, but I was really excited about the fact that I could be back on my feet immediately and return to work shortly after. I had the Lapiplasty procedure done on my right foot in November of 2017. I had to wear the boot for 6 weeks after my procedure. I returned to work 2 weeks after having my surgery, as long as I did not do any heavy lifting, any strenuous activity, then I was okay.
Laura had a very typical traditional post-op recovery with the Lapiplasty procedure. She experienced no setbacks and was back to running at 4 months.
My foot is feeling great today after having the surgery and going through all of the recovery. I have no pain. I'm able to be on my feet all day at work with no problems. The Lapiplasty procedure has improved my quality of life because I'm able to do all of the things that I enjoy doing, and I'm able to do it without pain. I am able to come home from work and play with my kids, run them around without having to sit and rest first. In my years of working as a physical therapist assistant, I have seen some patients that have had the traditional bunion surgeries, maybe not right away, but years later I've seen how the bunions were starting to cause them more pain, the toe was starting to drift over more, and they weren't 100% satisfied with what they had done. I would recommend the Lapiplasty surgery to anybody that's having bunion pain. I was able to get back to the activities that I enjoy doing and doing them without pain.
Only a surgeon can tell if Lapiplasty 3D bunion correction is right for you and what level of activity you can expect after healing is complete. There are potential risks with surgery, and recovery takes time. Potential risks include, but are not limited to, infection, discomfort from the presence of the implant, loosening of the implant, and loss of correction with non-union or malunion. Please consult with a physician for complete information regarding the benefits and risks associated with the Lapiplasty procedure.